Welcome back to the Understanding Dementia Care video series. In our last segment, we discussed the importance of comprehensive dementia care as a model. Let's shift our focus to caregiving for those living with dementia. From your perspective, and I'll start with you, Katie, as an expert in the field, are family caregivers of people living with dementia getting what they need from their healthcare providers and from community-based services? What's going well? What needs to change?
I think that the answer is probably no. They're not, as a group across the board, receiving the kind of help that they need. And we know that because we hear it all the time from family caregivers. Research shows it. Data that's collected now, asking family caregivers how they're doing, show that they say that they need more help. And that doesn't mean that some aren't receiving great help. I think that they are, and there are services that are or programs that are more effective in helping family caregivers. But many family caregivers say that the physician, their person with dementia's physician, doesn't pay attention to the caregiver, might not even acknowledge them. Some say that the healthcare system doesn't have contact information for the family caregiver, even though that person is the main source of care for the person with dementia. But I think that we don't do well on this, despite a lot of people's great efforts and a lot of research funding and a lot of community service funding. So what would you say, David?
No, I completely agree with you, Katie. And I think it's worth mentioning that the issue of not attending to the needs and situations of dementia and all that it brings isn't just a healthcare problem. It's a societal problem. Mm-hmm. And it's a public health problem. Mm-hmm. And I think we need to, and we're making progress, but we need more of bringing dementia out into the public so that people understand what it is, and people understand what the symptoms are, and people understand that it's not a thing that one needs to become isolated and a hidden problem. And reducing that stigma at a societal level is a backdrop for helping all of the limitations of the current system of services that we have.
I'd like to start with you, David, for this. Can you talk about best practice caregiving and how you decided to create an online database of caregiver interventions for professionals and organizations? How did that all come about?
Well, Katie is the origins of that. But Katie worked on this many years ago. The beginnings of this were back in 2012, 2011, and Katie did the foundational work that helped to show that best practice caregiving was important and a valuable resource that needed to be developed. And the reason for that is key. The reason is that the work of researchers and clinicians over the last 30 years have yielded many programs, non-pharmacological programs, programs that are not involving drug therapies or drug interventions, non-pharmacological programs, many of them that have been proven to work and proven to work in rigorous research. And that research has really taken hold over the last 3 decades. And now there are many programs that work, meaning lead to beneficial outcomes for persons living with dementia and their caregivers, especially for caregivers. And best practice caregiving is a way for people to learn about those top programs, the ones that work, have proven outcomes. And another part of best practice caregiving is really honing in on those programs that are ready for implementation in communities, not just part of a research study. And all the programs in best practice caregiving have actually been implemented as a regular program in communities. So these are all programs that have been proven effective in research. They're available to replicate and deliver in communities outside of a research study. And delivery of these programs might be by a healthcare organization, a hospital system, might be by a community organization, even an independent provider working on their own. These programs are available to all these sources. And all these programs have been done and shown to be feasible in a real world environment. And because of that advance, because these programs exist now, that's why it was time for best practice caregiving to be developed. And just as a bit of background, best practice caregiving is a website, an online tool that is free. It's a result of a collaboration between many partner organizations. The Gerontological Society of America, where Katie is a visiting scholar. Family Caregiver Alliance, a nonprofit in San Francisco that has focused on caregiving issues since the early 1970s and is a leading organization in the field. Benjamin Rose Institute on Aging, where I work. We partner also with some funders who are key to this. The John A. Hartford Foundation has been a moving force in bringing attention to evidence-based programs, proven programs for family caregivers. And they helped us start this initiative and stay with us today. The Archstone Foundation, the RRF Foundation for Aging, are longtime partners in best practice caregiving as well. And there are others as well.
Best practice caregiving includes only programs that benefit family caregivers. So if there's a program that shows that it benefits a person with dementia, but does not benefit the family, there's no data often on families or whatever, then it's not in best practice caregiving. So there's a very, very strong push to look at what can help families.
So I hear that you have a new consumer directory that may be coming out. Can you talk more about that?
The first version of best practice caregiving, which is available now at the website of Family Caregiver Alliance, which is caregiver.org, and it's called Best Practice Caregiving at caregiver.org, was designed for professionals. We started with professionals because one of the things that we learned, and others have reinforced this many times, is that although these programs are proven effective, many communities don't have many of them available to families. And so we wanted a place where professionals who were thinking about starting a program, people from organizations, healthcare systems, community organizations, could go to find all the information they needed to decide if one of these proven programs would work for their organizations. So it's a professional version that's there now. It has great detail on all the characteristics of these approximately 50 programs that are included. And it tells about the research side of these programs and how they became evidence-based. And then it tells about all the characteristics that you'd need to know, the nitty-gritty things an organization would need to decide, is this something that matches our needs as an organization? Do we have the staff to do it? Is there training available? How much does it cost? Does it require software packages? All the things that you might need if you were an organization. And importantly, we also wanted to know about the experiences of organizations that have actually delivered these programs. Because even though many organizations don't do any of them, there are a good number that do. And so we tried to get information from the organizations that delivered these programs to find out how they worked and what were the successes and what were the challenges. So that's the professional version of best practice caregiving, which is available now. But as you said, Liz, we're nearing the final phase of development for a version for family members and friends to use. And the key for that is that a family or friend caregiver will be able to go to this website, again, a free website, part of caregiver.org's website, and put in their zip code and be able to find all the organizations near them that are offering one or more of these programs with a summary description of the programs that give them the essential information that a family member or a friend would want to know if they were thinking about using a program. And you know, our hope is that this kind of a tool will be an easy place for families to go to find quality information about programs that are proven to be effective. And maybe some of those family members and friends will decide to use one of these effective support services for their own good to help them, or encourage another family member who's the main caregiver to consider a program, and be able to realize Katie's point that there are beneficial, helpful things that can be done, and it isn't just a hopeless situation that is hidden behind closed doors, that there's a place for support, there's a place for hope, and these programs are part of that.
Yeah, it sounds like both of these tools are getting the word out to very key gatekeeper key groups to learn about. So I want to thank you both for sitting down with me today. As I said before, it's been delightful seeing you both and to hear from you. And for more information on RTI's expertise in this area, please visit us at rti.org and search for the focus area, Alzheimer's disease and related dementias. Thank you both.
Thank you.